So the first part of our course, inshallah, is going to be about basic endodontics, and we are going to have to talk about a few topics. We are going to have introduction, we are going to talk about diagnosis briefly, and the principles of access cavity preparation. Also, we are going to talk about cleaning and shaving, hand instrumentation and rotary instrumentation as well. Irrigation and medicaments that we need to use during root canal treatment. And finally, for the morning session, we are going to talk about obturation techniques, inshallah. So we have two reasons to do root canal treatment. The first one is to prevent apical periodontitis. When there is no apical periodontitis, but the pulp is inflamed, or there is a necrosis in the pulp and there is no apical periodontitis, we have to do root canal treatment to prevent apical periodontitis from happening. The second reason is to treat apical periodontitis, whether it's symptomatic or asymptomatic. If there's symptoms or no, but the lesion is present, we have to do root canal treatment to cure, to heal the lesion. But before you start root canal treatment, you have to know the chief complaint of the patient, why the patient is here. There is a reason for the visit. Usually the patient, our patients in this region or in the country, they come just for pain relief. They are asking for pain relief. They don't come before the pain starts. You need to know the medical history and dental history. And the medical history, you have to know whether the patient for treatment or not. And you have to have endodontics diagnosis. Before you start any treatment, you have to have a diagnosis. So if you cannot make a diagnosis, please don't start the treatment, because your treatment will be incorrect, will be wrong. There will be a problem, because you might treat a wrong tooth. So in endodontic diagnosis, we have two parts. We have to have a diagnosis for pulp, and we have to have diagnosis for periapical tissue, whether there is a lesion or there is no lesion. Is there chronic abscess, acute abscess, there is a stoma, there is no stoma, there is a cyst or not. Also, you have to check the pulp, whether the pulp is inflamed or the pulp is healthy. There is a necrosis in the pulp or not, before you start any treatment. Then, after that, after you make your diagnosis, you might proceed to the treatment. This is one of the things that many students or even dentists, they don't pay attention to. You have to put the patient in a proper position. For maxillary teeth, for all maxillary teeth, you need to put the patient in supine position. Will be easy for you. And for mandibular teeth, you need to put the patient in either semi-supine or semi-upright, so you can see the lower teeth easily. Then after you have the patient seated on the chair, you need to do your examination. You need to start with the extraoral examination. You need to see if there is asymmetry, there is a swelling, if there is any changes in extraorally. Then you need to go inside the mouth doing your test and do the intraoral examination. And as we said, you have periapical test and pulpal test. You need to do those tests, and you have to have radiographs. Radiographs are important. Don't start any treatment without taking radiographs. So for diagnosis, as we said, we have pulpal diagnosis and we have periapical diagnosis. For periapical diagnosis, we can use percussion. You can percuss the tooth, or you need to tell the patient before you start percussion that you are going to tap the tooth. Then you can do the palpation around the teeth, the apices of the teeth. It's better to start bilaterally to see if there is any asymmetry. And we might use bite test. For bite test, we can use the wood stick, we can use cotton roll, or tooth slough. For pulmonary examination, we have either thermal test, which is cold, or heat test, and the cold is more accurate than either the heat test or ABT. Also, you need to tell your patient before you put the cold test that I'm going to use cold. If you feel pain, raise your hand until the pain goes away. Rotative grafts are important, and by recommendation of American Association of Endodontics, you have to take at least 2 periodical X-rays and 1 bite ring. Why we need to do that? ليش ناخذ 2 X-rays? Superimposition. If there's extra roots or extra canals. Lesion, sometimes you cannot see the lesion in 1 X-ray. Then you need to take more than 1 X-ray. Bite ring, why do we need to take bite ring before we start root canal? If the tooth is restaurable or not. Also, I can measure the distance between the furcation area and the occlusal surface of the tooth before I go for penetration. And this step is very important. If you have any stoma اللي هي الفستولا, الأوبننج الموجودة around the tooth when there is chronic apical abscess, you need to place gutta-percha and take an X-ray to trace the source of the infection. And you need to tell the patient before you place gutta-percha that you might feel some pain. If you think you need anesthesia, just tell me, I will give you anesthesia. But regular or conventional X-rays are not enough. So we have to take CBCT in some cases. So like in this case, this is periodical X-rays, conventional X-rays. It's not clear if there is a fracture or not. But when we took the CBCT, there is a clear vertical root fracture. So CBCT is very helpful most of the time for your diagnosis. Also, you are going to know whether there is additional canals, there is missing canals or not. Here also you are going to see the distance between the root apex and mandibular canal. So also there are some special tests that we need to use if we cannot get proper diagnosis before we start the treatment. One of the special tests is test cavity. We call it test cavity if there is no lesion around the tooth, like in this case. If there is no lesion, but there is a stoma, like in this case, this is my case. We did a root canal for this tooth, and we found that the tooth is vital, and that the problem is not coming from the same tooth. It's coming from a different tooth, and we are going to see it, inshallah, in periodical surgery. Anesthesia test, you might need to do an anesthesia test if the patient is having pain in upper and lower area and cannot determine where is the source of the pain. Transillumination, if you think there is a crack in the tooth, you might use transillumination, and you put it in the either buccal or lingual side, and you see if the light cannot go to the other part of the tooth, then there is a fracture in this area. Also, you can use dye or methylene blue to check if there is a fracture. This is after you open the tooth and you don't know if there is a fracture in the tooth or not. You might use dye or methylene blue. أحد يساعدنا في هذا الميكروفون؟ Microscope is a very helpful tool. Inshallah, بكرة وبعد بكرة you are going to try the microscope and see how it looks. Surgical exposure, sometimes we need to do a surgical exposure. We need to open a flap and to see what is the problem, because sometimes we cannot just do a diagnosis from a clinical examination or radiographic examination. Then we have to do a surgery to check if there is, like in this tooth, there was a vertical root fracture and we couldn't see it in the regular x-rays. Nowadays we can use the CBCT to help us diagnose the vertical root fracture. So usually or mainly the cause of the infection in endodontics is bacteria. So bacteria is the responsible for endodontic infection. But also we might see viruses or fungi in cervical area. So when you need to do root canal, or when can you start the root canal? هذا سؤال مهم. الآن عندي الحالة موجود البيشنت، السن موجود، متى أنا أسوي الروت canal؟ So after you check the medical and dental history, you can go through the procedure, you can do the examination and get the medical and dental history, and you have to have a diagnosis. If you don't have a diagnosis, don't start any treatment. The treatment should not be started if you don't have a diagnosis. The tooth is restorable or not? In many cases, some of you, they start the root canal treatment for non-restorable teeth. So the tooth should be restorable before you start the root canal treatment. You might need to remove a caries, then check if the tooth is restorable or not. Anesthesia, and this is the most important part of the root canal treatment. You have to check whether the anesthesia is working or not. How would you do that? كيف نتأكد من الأنستيجيا شغالة أو لا؟ هذه كلها أعطيتكم السنة الماضية السنة اللي درس رابع وخامس عندي. ها؟ ما أسمع. You need to check the chief complaint. So if the patient has pain with cold, just take the cold test and put it in the tooth. If the patient still feels pain, then the anesthesia is not working. If the patient has pain with bite, you need to do the bite test. Okay, so what are the reasons for failure anesthesia? Apprehensive patient, 1. And if there is inflammation and the pH is low, then the anesthesia might not work. Rubber dam. Are you able to place a rubber dam on the tooth that you are going to treat or not? If you are not able, then don't start the treatment. Unless you are going to do emergency treatment, إذا بتسوي emergency treatment and you cannot place the rubber dam, you might just do the emergency treatment. So what are the triad of endodontic treatment? Biomechanical preparation, and you have microbial control, and the complete obturation of the root canal system.